I was thinking of what sort of things that I can talk about, and because COVID-19 has pretty much touched our lives in a lot of different ways. So there are various aspects, and in a place like I am Bangalore, a lot of my colleagues have been looking at sort of different aspects of COVID-19, how it can affect how the government works, how it can affect how it will affect the government works, how it will affect how industries work, different industries work, so on and so forth. And and I have also been doing a little bit of work on that. So that's what. So I thought that okay, fine. Let me just talk about something that I'm sort of familiar with a little bit. Okay. So I decided to talk about COVID-19 and income inequality. Okay. So why this particular topic? So I mean, if you look at, it's been more than 4 months since sort of the lockdown started, since we really started taking COVID-19 seriously, and of course in this past few months, a lot of research has been done, and I think it will continue to be done in the near future on effects of COVID-19 on different aspects of the economy. And there's been a lot of work done on GDP. So how COVID-19 could potentially affect GDP, not just at the aggregate level, but also at the sectoral level. So, and this has been done for every country. This has been done for India, and there's sort of this understanding that maybe some sectors of the economy might be more affected than some other sectors. And then the question is, okay, how can the government? What should the government do? How can the government help, and so on and so forth. So there's been a fair bit of work on this. Now, relative to this strand of work, much less attention, in my opinion, has been paid to income inequality. I mean, while we understand that maybe inequality could be affected because we see that the effect of COVID-19 is not the same on everyone, but I wanted to kind of think more carefully about it and try to get some insights from a model and sort of an economic model. So that's what I'm going to do today, essentially. So my talk is going to be sort of focused on how the pandemic, this ongoing pandemic, might shape income inequality, and this is. As I said earlier, so this is something I've been working on, started working on very recently, obviously, because it's sort of related to COVID. So it's based on, so whatever I'm going to talk about today is based on a working paper that I have with one of my colleagues at IIM Bangalore, Srinivasan. So again, this is sort of a very this work is very preliminary, so the results that I'm going to show you are sort of very preliminary. But but I think some of them are are pretty informative about what or how COVID-19 might affect inequality, and I think they have some sort of interesting insights. Okay, all right. So the first kind of point that I want to make is there is COVID-19 kind of has brought back this discussion about this new labor market divide. So what do I mean by this new labor market divide? So if you sort of traditionally look at the labor literature, okay, the labor economics literature, like historically, the division that people sort of generally talk about is between high-skilled workers and low-skilled workers. Okay. So, of course, I mean, we have. I mean, if you look at the actual skills of workers in a country, then it's not like there are not like two skills. There's a continuum of skills, but we can sort of broadly divide, people into high skills and people into low skills. Now, and if you think about inequality, when we think about inequality, there's a very close relationship between income inequality and the skills. Okay, so inequality is not only a result of skills. So it's not just the case that why is someone rich and why is someone poor? It cannot be entirely explained by their underlying skills. There's a lot of other things, there are a lot of other factors, but skills are definitely important. Okay, so if you look at the distribution of income in a country, if we might see these some of these to have long-lasting impacts. Okay, so some of these could be, if not permanent, but they might last for another few years or so. So this labor market divide, as I said, like traditionally the labor market divide has been between high and low skilled workers. Okay, now in the post-COVID world, I think the important labor market, or the key labor market divide, is really between workers who can work remotely, meaning from their home, and workers who cannot. Okay, so there's some workers who can work remotely. They can just sit in their home, with their laptop and whatever, or their phone, and continue to work. And then there are workers who can't do that, who have to go to their office or who have to go to their workplace, wherever that is, to actually sort of carry out their to do their jobs. Okay. And this is something. This is not like rocket science. You just look around and you see people doing different kinds of stuff, and you see that a lot of people, like what they're doing, and they cannot do those things, and they cannot carry out their work from home. Whereas for a lot of other people, they can, right? So, for example, an airline booking agent. Okay, so someone who sort of you call a number and that person takes your reservations. It does not really matter. It does not really matter where that person is located physically. Okay? The person could be in an office. The person could be in his or her home. Okay, so and that person could kind of continue to provide the services that are expected from him or her without significant loss in quality. But look at the same industry or whatever, someone sort of who does something related, which is an airline pilot. An airline pilot has to go to the airport and then board the plane. Okay, so the occupation that this airline pilot is conducting, or is carrying out, requires that person to be physically present in the workplace. So what COVID-19, or what is going to happen in the aftermath of COVID-19, and this is something we're already seeing, is that workers who belong to this latter group, so workers who belong to the group where you cannot really work from home, you have to go out, they're the ones who are going to lose out more. Everyone is going to lose out. Most of the workers in the economy are going to lose out, but because there's some sort of aggregate effect. But the losses are going to be much more for this second group of people. Okay. All right. So let me sort of give you some numbers. So this is sort of a table from our paper. So let me kind of explain what we're. The information that is there in the table. So the first column, it says NOC codes. So NOC stands for National Occupational Classification. So what happens is that we have we have a government agency. I think it's the Ministry of Labor. So they basically so they look at all the classifications and all the occupations that are being done by Indian workers. And then they classify these occupations into different categories. Okay, sort of very broad categories. Of course, under each of these categories, there are many sort of finer sort of occupations. So, and then they assign a code. So, of course, the codes don't tell us anything. Then we have to look at the title. So that's the second column of the table. Because the title sort of tells you what those occupation codes are. So, for example, the first code, code 1, is for legislators, senior officials, and managers. It's sort of a group that combines like different kinds of people or people doing different types of stuff, but it's just, anyway, that's what the government did. Okay, Group 2 is professionals, and Group 8 is plant and mission operators. Group 9 is elementary occupations. So elementary occupations is this miscellaneous group that essentially has a lot of different occupations that don't really fit into any of the remaining categories. Okay, so whatever you can't fit in the other categories, you put them under elementary occupations. So there would be things like, drivers, cleaners, sort of construction workers. Okay, so a lot of these, and they're typically workers who are providing some sort of manual providing sort of manual service, okay, or carrying out manual jobs. Okay, so the important thing here, which I sort of pointed out, is the third column. Okay, so the third column is skill. So what the Ministry of Labour sort of did is that they sort of took these occupations. Okay, let's see, for a slideshow, let me see. Okay, is this better?
Yes, font size is better now.
Okay,
yes.
Okay, all right. Okay.
Thank you.
Yeah, okay. Thank you. All right, so yeah, I know. I think for this table, I think that some of the numbers might appear very small. So, okay, so skill. Okay, so what does third column? What does it denote? So skill sort of refers to. Well, so it's okay. So how do they do that? So basically, what they do is that they create 4 groups for skills, 4 classifications for skills. Okay, so 1, 2, 3, and 4. If you go through the column, there are basically 4 groups. So 1 is basically sort of primary education. So those workers who did not complete high school. 2 is secondary education. 3 is some undergraduate degree like bachelor's degree, and 4 is postgraduate degree. So people now, of course, even within any of these groups, there are you have different occupations and workers in different occupations. Of course, and some of them might have completed high school, some of them might have completed undergraduate, like bachelor's, some might have completed postgraduate. So essentially, what they do is that on average, they try to compute that for each of these occupations, what is the corresponding skill level of the people who are carrying out these occupations. Okay, so on average, what is the skill level of professionals? Okay, so and that is they from the data, it seems that most of them are postgraduates. Okay, and so what is the average skill level of service workers and sales workers? So the data says that it's category 2, which means that they are typically they have typically a secondary education, but not more than they never went to. Most of them did not go to college. Okay, so that's how they create this. The fourth column is share. So this is basically the share of each of these occupations in India. Okay, so if you look at all these workers, if you look at all these occupations, then about 10% of the people who are employed in India belong to category 1, which is legislators, senior officials, and managers. Okay, about 5% belong to category 2. 4.6% belong to category 3. Okay, so these are the numbers for India. So this is the distribution of occupations, the distribution of workers in different occupations. Okay, the last column. Okay, column 5, which is ATA. So that's really kind of the new thing here. Okay? So what we are sort of which is going to play a very important role in in our paper. So this number it's a fraction. Okay, so these are all lying between 0 and 1. So this number sort of captures the fraction of workers in each of these employment groups who can work remotely. Okay, so if you look at the first occupation codes, like senior officials, managers. Now, so there are many of them. Okay, there are thousands, hundreds of thousands of such workers in the economy. Out of them, on average, about 34% can work from home. Okay, now this number. So this is something that we did not come up with. This is based on work done by other people. So they kind of look at these occupations and they try to, they have detailed information about what people in different occupations do, what sort of technology they use, and they've come up with these numbers. Okay, so So professionals or associate professionals, for them, like the tendency to work from home or the ability to work from home is very high, or it's quite high. Okay, it's like 30%, 25%, something like that. Look at the occupations at the bottom of the table. So look at occupation code 8 or occupation code 9 or occupation code 7. Okay? So trade workers or machine operators or elementary occupations. So there, the ability of these workers to work from home is almost nil. Okay, so they'll find it very, very difficult to work from home because of the nature of their work, right? A driver, a bus driver cannot work from home. The bus driver has to go out and drive the bus. Okay, it's a very simple point. Okay, but this number is important. Okay, so what we see here is that if you classify workers according to different occupations, it seems that workers who are highly skilled are also have a higher ability to work from home. Workers who are low skilled, typically low skilled, don't really have an ability to work from home. They have to go out and work. Okay. All right. So now if you kind of look at if you sort of compare one economy sort of at the aggregate level with another economy. So let's say if we compare India with a country like United States, the fraction of workers who can work in India is typically much lower. So at the economy, so now we're not looking at individual occupations, we're looking at the entire economy. Okay, so the fraction of workers who can work in India is much lower than say US or France, Germany, UK, like any sort of developed country. And this is because of two factors. Okay, so the first factor is for any given occupation, the ability to work remotely is lower in India. So let's pick the occupation code 2, which is like professionals. Okay, so if you look at the professions in India and if you compare them with the professions in the United States, the professions in the US can actually are more likely to work from home or have a higher ability to work from home. And this is because of technology, because of how, because of the nature of work, the kind of equipments they use, the kind of technology they use. So for any given occupation, that's the case. But at the same time, in India, in a country like India, more people are engaged in occupations in which working remotely is difficult. Okay, so we know that there are these occupations like these occupation codes 6, 7, 8, and 9. Okay, so machine operators, elementary occupations, salespersons. Okay, so these people generally cannot work from home or find it very difficult to work from home. And in India, in a country like India, a large fraction of the population is engaged in these occupations. A much smaller fraction compared to the United States, or Germany, where a much smaller fraction is engaged in these kind of occupations. Okay, so both of these reasons can potentially drive a difference between how likely a worker in India, a typical worker in India, can work from home as opposed to a country like United States. Okay, so we did some sort of rough calculations, and what we found is that if you look at high-skilled workers in India, around on average, okay, 32 out of 100, so roughly 30% of high-skilled workers in India can work remotely. Again, you have to keep. So the important word here is important phrase here is on average. So again, within occupations, there's a lot of heterogeneity. And if you look at professions, some professions find it very easy to work from home. Some professions may not find it very easy to work from home. But again, on average, about 30% of workers can work from home. High-skilled workers can work from home. What is the corresponding number for low-skilled workers? It's 4. So 4% of low-skilled workers in India can work from home. The remaining 96%, they can't. They have to go out. Otherwise, they don't earn a living. They cannot earn a living. Okay? So the difference is sort of stark. And so this is this is really the motivation for our paper. So given this big difference, and given that COVID-19 given this big difference, we think that COVID-19 will affect these two sets of workers, or these two groups of workers, very differently. Okay. All right. So that's kind of introduction. So that's where we are coming from. So that was basically our thinking when we decided to write this paper. So now I'm going to get into the paper, and again, it's like I'm going to be sort of pretty brief, so I'm not going to show any math. I'm not going to show you any questions or anything as such, because I don't really have time for that. But So I'll just give you kind of the main elements of the model, sort of the main sort of driving force of the model, the main mechanisms, and then I'll show you some results that will highlight the point that I'm trying to make, which is that inequality, that in this post-COVID world, income inequality can go up significantly. Okay. All right. So the model. So what is this economic model that we're using? So well, basically we're going to combine two models. Okay. Our paper basically combines two models. There's an economic model, and then there's another model that I'm going to talk about in the next slide. So essentially what we do is that we are going to embed something known as an SIR epidemiological model. Okay, so this is an epidemiological model is. So these are essentially models that are used by epidemiologists who are trying to study pandemics. Okay, so they sort of how will as a pandemic progresses, how will that affect the number of infected people? How will that affect? Okay, how will infection sort of evolve over time? So these are typically models that are used in that literature, and these are being used like for a long time. So what we do is that we sort of take kind of a standard epidemiological model, and we combine it with sort of a standard macro model. So this is the type of macro model we use is known as a DSG or dynamic stochastic generic model. So these are sort of standard models or standard frameworks used in macro. So we sort of embed an epidemiological model into a standard macro framework. Okay, so there are two types of agents. So as I kind of hopefully I've been sort of able to convince you that at the end of the day, what matters is whether you can work from home or not. And it seems that whether you can work from home or not really depends on your skills. So at the end of the day, it is really your skills. Okay, so in some sense, the new divide, the new labor market divide that we're talking about is actually quite related with the old labor market divide. So whether you can work from home or not really depends on whether you're high skilled or not. Okay? So we have these two types of agents in the economy: high skilled and low skilled. And we allow agents to work from home or work on site. Okay, remote working or on site working. So you can go to your office or you can work from home. And the way we sort of model this division is that we say that, look, compared to high skilled workers, low skilled workers are much less effective when they work from home. Okay, so that's sort of a way to model this inability of less skilled workers to work from home. Okay, so basically what we're going to say is that, look, if you're a low skilled worker and you work from home, then your productivity suffers a lot. Your productivity declines a lot. Okay, so which means that working from home is not a very good option for you. And then agents in this economy, they can work and they also consume. Okay, so you also decide. So you work, you earn an income, and you decide, and then you basically spend that income. There's a consumption. There's a consumption component also. All right. So that was the economic model. So and then there's the disease model. The disease model is this SIR epidemiological model. So what does SIR stand for? So why is it called SIR? So SIR basically stands for, so S stands for susceptible, I stands for infected, and R stands for recovered. Okay, so at any point in time, so once the pandemic starts, at any point in time, you have a fraction of the population that is susceptible, so they have not been infected. There's a fraction of the population that have been infected, okay, and that are currently infected. And then there's a fraction of the population who have recovered. Now, of course, there's a fourth category, which is the people who are deceased, who sort of pass away. But here, like what we do in our model is that we sort of combine this category of this disease category with the recovered category. So recovered here means that you were infected in the past and now you're not infected anymore. So either you are. So what that means is that you are still alive and you're sort of fine, or you did not make it. Okay, so you sort of. All right, so that's basically, so these are three categories. So now how can disease spread? In this economy, how can disease spread? So as I said, this is sort of an economic model. So disease can spread through consumption. So when you decide to consume, consumption might require sort of going out. Okay, so you can go to a shop, you can go to a mall, you can go to a restaurant, a movie theater, whatever. Okay, so when you consume, when you go out for consumption, you can get infected because of that, because you're coming in touch with, you're coming in contact with other people. So if you decide to change or reduce your consumption, then that has an effect on how this disease sort of spreads. The thing that we kind of really want to focus on here is on-site work. So if you go to work, okay, then you expose yourself. You have this. There's this risk that you can get infected. Okay, so that would sort of influence your decision of whether you want to go to work or not. Now, of course, that combined with the fact that you stay at home, there's an effect on income. Okay, so you're going to think about this. But if you go out to work, disease can spread through that. And then the third category is social interaction. So this is like whatever. If there's a certain amount of infected people in the economy, and there's a certain amount of susceptible people in the economy, then at every point in time, people will get infected. I mean, you will at some point come in contact with others. Even if you're not infected yourself, at some point you'll come in contact with others who are infected, and you contract the disease. Okay. Now these SIR models, kind of this pure SIR models that epidemiologists have been using in the past, they only had this third component, social interactions. Okay, so in those models where they were not economic models, they were sort of pure models of disease spread. So they only had, so disease could spread only through social interactions. So what we do is that we introduce an economic component to this model. So we say that, look, individuals in this economy make decisions, economic decisions, and those decisions have consequences for how fast or how slow the infections spread. Okay, so that's something that we do. And anyway, we're not the only ones doing this. There are other papers that do similar stuff. Okay, that are doing using similar models. Okay, all right. So then, so the question is, okay, so what is the worker doing? So the worker sort of essentially faces the following decision. So there's a trade-off. Okay, the workers will optimize. They will choose to do something optimally, and optimality essentially means that there's always a trade-off. So so there's a cost of doing something, and there's a benefit of doing something. So you're going to balance the cost and the benefit. You're going to balance the marginal benefit of doing something with the marginal cost of doing the same thing. So what is the worker deciding to do? The worker, so on the one hand, the worker, if the worker works remotely, then the chances of getting infected are lower. That sort of it makes sense. But it also lowers income. Okay, if you work remotely, it lowers the income. But again, the effect of lower income is not the same for everyone. So there are some workers in the economy whose income may not actually go down at all, right? But there's some workers in the economy whose income will go down drastically if they choose to work from home. And then there are all these workers in between. Because there's a heterogeneous effect of working from home on income. And that, as I argued earlier, is going to depend on skills. Okay? So whether you're high skill or low skill, it's going to, that will determine this choice. And lockdown, so when you impose a lockdown, by raising the cost of working on site, okay, so we think of lockdown as imposing a cost of working on site. So you can't go out, you can't go to work or whatever. You have to maintain social distancing while working. Anything that raises your cost of working on site, it will affect this decision. It's going to influence your decision to work remotely or to work from home, or to work remotely or to work on site. Okay. All right. So what we do in the paper is we look at So we wrote this paper. Kind of the first draft of this paper was like in early April. I mean, we started writing the paper in sort of middle of March, just when the lockdown started, and then early April we kind of had sort of the first draft. And at that time we didn't really know. I mean, no one really knew how this thing is going to progress. No one really knew what the policy of the government would be like. So you go into a lockdown. Like, how long will the lockdown last? It lasts for 2 weeks, for 3 weeks, for a month, for 2 months. Okay, so and maybe you have a lockdown, then you remove the lockdown, you again impose a lockdown. So all these things we were not really sure of. Okay, at that point, there was a lot of uncertainty, and I think there's still a lot of uncertainty, but maybe slightly less. So what we did is that we looked at different components of different types of lockdown. So we looked at something called sustained lockdown, which is that you lock down the economy for an extended period of time, like a few months. Then we looked at something called staggered lockdown. So staggered lockdown is you lock down the economy. So there's a very serious lockdown for, let's say, 1 month, and then you ease things a little bit. Okay, so you allow some people to go out, and then that happens for another month, and then you ease restrictions a little bit more for another month. Okay, so you start with a very severe lockdown and you kind of make it less and less severe over time. We also looked at something called intermittent lockdown, which is that you impose a lockdown and then you remove the lockdown and impose it again. So we're actually seeing something like this now. I mean, some states or some cities are doing intermittent lockdown. Okay? So impose lockdown, remove it, and then after a month, again impose lockdown and whatever. So no one really knows how to handle this, right? So governments are sort of trying out all kinds of policies. So we look at all these different scenarios. I won't have time to go through all of them. So what I'll do is I'll just focus on one. But anyway, I mean, qualitatively, the results are similar in all these situations. That's okay. So I'm going to focus on just one scenario, which is a sustained lockdown. And I'm just going to, what I'll do is that I'll show you some graphs. The next couple of slides, I'll show you some graphs that I think sort of brings out the results, or shows the results in a very sort of clear and transparent manner. So essentially, so as I said, the nature of the lockdown that we're considering is sustained. So the left-hand side picture with sort of the black dotted line, so that's kind of lockdown. So we are looking at, along the horizontal axis, we're measuring the days. So starting from day 0. So in our sort of calculation, we were thinking of day 0 as 1st January, so the beginning of this year, and then it goes up to day 500. So sometime like the middle of next year or something. Okay? And sustained lockdown this is sort of a severe lockdown. So this is kind of basically what the way again sort of we model this is that we said, okay, government imposes a cost on-site labor. So if you go out, it's going to be very costly for you to go out, okay, because of all these restrictions. So impose the cost, and then that cost sort of remains the same for an extended period of time, and then sort of goes down. So that's the nature of the lockdown. So now let's look at some of the results. So on the right-hand side, the picture on the right-hand side, you have, we're basically looking at on-site labor. So what happens to on-site labor compared to, so before lockdown, like there was a certain amount of like high-skilled and low-skilled workers were, were working for a certain number of hours every week. And now because of the lockdown, we expect it to go down. The question is by how much. So what we see here is that we're plotting the on-site labor for both high skill as well as low skill workers. So the blue line is high skill, the red dotted line is low skill, the red dashed line is low skill. So for low skill workers, it goes down. It goes down a little bit because there are restrictions, so it's not that easy for you to go out. For high skill workers, it goes down a lot. And again, the idea here is that, look, high skilled workers, because of what they do, because of the nature of their work, they can, or many of them can afford to just stay at home and continue working. I mean, in our profession, like professors, teachers, whatever, we continue to teach, from our like home or whatever, right? So we can continue to provide the same kind of services with, pretty much the same kind of quality without, just from our home, without having to go to a classroom and teach in front of, a lot of students. Okay, and this is true for a lot of occupations, a lot of professions. But for low skilled workers, that is a luxury, and most low skilled workers cannot do that. They have to kind of go out. So sure, there is an effect. We do see a slight cutback or slight reduction in on-site labor coming from low skilled workers, but they still continue to go out. They will continue to go out despite these costs. Okay. Now, so I sort of talked about inequality. I've been sort of talking about income inequality. One of the interesting things that comes out of this paper is that there's another inequality. So there's the inequality between high and low skilled workers increases not just in terms of income, but it also increases in terms of health outcomes. Okay. So what do I mean by that? So this is a picture of infections. Okay, so how the infections, again, this is something that kind of comes out of these epidemiological models. Okay, so in our so you might have, I'm sure all of you have seen at some point sort of graphs that kind of look like this. So as the pandemic sort of progresses, infections will sort of go up. It will kind of hit a peak and then it sort of come down. So I have two pictures here. So the left-hand side corresponds to infections for the high-skilled workers, and the right-hand side corresponds to infection for the low-skilled workers. And again, so this is where along the horizontal axis we're looking at the number of days. Along the vertical axis we're measuring everything as a percentage of the initial population. Okay, so 10 here means that 10% of the initial population is infected. Okay, 5 means 5% of the initial population is infected. So if you look at the first picture, so the green line corresponds to the benchmark. So the benchmark is basically where there is no lockdown. Okay, so suppose the government did not do anything, how would the pandemic kind of play out? And so it sort of has this bell shape. It goes up and sort of comes down. Now this paper we sort of wrote, as I said, like we wrote it sort of in late March, and so if you kind of look at the scale, like if you look at the horizontal scale, it says that the infections, in the absence of any kind of government intervention, infections would sort of peak after roughly 220 or 230 days. So that's around late July, early August. So we are sort of at that period. But I don't think we have peaked yet. But anyway, at that point, whatever. I mean, this is what our models will predict. Now, what happens when you impose this lockdown? The curve moves down. This is the flattening of the curve that epidemiologists have been sort of talking about. That if you impose a lockdown, you can flatten the curve, and it sort of flattens dramatically. Okay, so it sort of goes down for the high-skilled workers. It goes down dramatically again because many of them are switching to working from home. Okay, the picture on the right is the same, but now for low-skilled workers. Now, what you see is that for low-skilled workers, again, there is a flattening of the curve, but it's much less pronounced. Okay, so there is a reduction in infections, and as a fraction of the population, it's much less compared to high-skilled workers. So this is the second inequality. So there's an inequality in income, and then there's a second inequality, which is in health outcomes. So because low-skilled workers are going out, they're forced to go out to earn their livelihood, they're also exposing themselves to greater risk. They're also more likely to get infected. So there's a difference in income outcome, in income inequality. There's difference in their incomes, but there's also difference in their health outcomes, okay? So that these two inequality that sort of, that increases because of the pandemic. All right, and I'm sort of almost done. So the last picture, so this is, so the left-hand side of the picture, so the graph on the left-hand side, so here we are measuring output. Again, so we're looking at sort of deviations from whatever there was before the pandemic. So these are all, you can read the graph as percentage decline in output from, whatever there was before the pandemic. So again, the green line corresponds to the benchmark and the black line corresponds to containment. Containment means there's some policy in place. So if the government did not do anything, output would have still gone down, and that is because some people would still have chosen not to go out and work from home, and that would have an effect on productivity and output. But in the presence of this lockdown, when you make it much more costly for people to go out, the effect on output is much more severe. So the black dashed line, you can see that it sort of lies completely below the green line, and the numbers are big. It's like, so this model sort of predicts, at least if you think of this as a model of manufacturing and services, if you're looking at only manufacturing services, there's like maybe a 70%. Well, it's not a 70% total decline in output, but at the peak of the infection, the output could be less than what it should have been, or what it would have been, by about 30%. Okay, 30% less. Okay. And the last picture, which is the picture on the right, so that's inequality. So that is what I've been sort of talking throughout. That's income inequality. So income inequality goes up, and it sort of goes up significantly. So essentially, as soon as the lockdown goes into place, inequality sort of jumps up, And then over time, as infections sort of spread, inequality sort of starts to go up, and it sort of peaks at some point, and it sort of starts to come down. And again, this is sort of happening because the low skilled workers, they're also choosing optimally whether they want to go out or not. So when it's very likely, so when infections are going up, they also choose, many of them are choosing not to go out, but that has consequences for their income. Their income is getting a huge hit. But as infections start to come down, they're also sort of going out, more, and that sort of brings down. And then when you remove the lockdown, you can go back to where you started. Of course, I mean, now we know, again, we wrote this in early April. Now we know that even when you sort of remove lockdown, I mean, like even if you remove some of these government policies, things are not going to be the same. Like these social distancing, all this will be in place for many months to come, and that will continue to have sort of permanent effect. Okay, all right. So I think I saw a question which is saying that why is income inequality a flat line before? But it's not the flat line does not mean there's no income inequality. There is income inequality, and what we are talking here is how does income inequality change after the pandemic relative to what it was before. Even before there was some inequality, okay, but because of the pandemic it increases. So relative to whatever there was before, it just goes up. And so once you remove the lockdown, it will eventually come down at some point. Okay, so that's idea. Okay, so I am. So that's basically. I took a little longer than what I wanted to. So conclusion. Again, I want to sort of to make a couple of quick points. So income inequality is about to worsen considerably. I mean, it has already worsened, and in the months to come, as I said, things are not going to go back to normal in the near future. We are months away from a development of a vaccine, and even if there's a vaccine, it will take again a long time to sort of distribute it and get it and sort of get people vaccinated. So at least till that point, the situation that I just highlighted is going to persist. So that will have a serious consequence on inequality. Okay, and evidence. So we don't really have evidence from India at this point because India, like sort of data is kind of an issue here. Like getting high quality data is a bit problematic. It's not easy. But in the US, economists have already started looking at this, and they already have some preliminary data from March, April, and May. And it seems that the effects that I talked about in this paper, in this presentation, those are already being seen. So, for example, in the US, what they're finding is that if you look at different groups in the population, African Americans, okay, they have been affected disproportionately more because of the pandemic. Okay, so they are the ones whose income has gone down much more compared to, let's say, white Americans. And one reason for that is that African Americans tend to be, like on average, they tend to be lower skilled than white Americans. They tend to be engaged in jobs and occupations that require you to be, you to go to your office or go to your, sort of place of work. Okay? And we are seeing effects of that. At least in some countries, and I think at some point when data sort of starts coming out for India, maybe towards the end of the year, I'm pretty sure we're going to see effects for India as well. Okay, policy, well, I think it requires a lot of government support. Government support, sort of a specific kind of support. So support towards low skilled workers. So people who are unable to go out, who are unable to sort of carry out their jobs from their home. Thing is, if you are, so what is happening right now is that they are forced to go out, and when they're forced to go out, you're also exposing them to higher risk, and that is not fair. I mean, compared to high skilled workers, low skilled workers they're exposing themselves to higher risk just because of what they do, just because of the nature of their work. So how do you alleviate this? How do you reduce this? Well, you have to give them income support. So that's kind of the policy prescription. Okay, so I have taken enough time, so I'm going to stop here. And thank you for listening to me very patiently. Thank you.
Thank you, Dr. Kunal Dasgupta, for your interesting presentation. Your paper is very much interesting, and you have discussed about income inequality skill distribution, and you have also discussed COVID-19 and lockdown, how skill distribution has done occupational distribution regarding working from home, and you also work on SIR model, that is epidemiological model, which is very much interesting and new. And also you have to focus on infection due to high skilled workers and low skilled workers. And I thank you once again for your presentation. And let us take few more questions. Some questions for you. One question is from Chandrakanta Saha. He has asked, how can we measure the ability to work from home? So,
Yeah, that's of course a very important, I mean, sort of a fundamental question. So we did not do that. So that's something I sort of showed you this table that kind of has information on this ability to work from home for different occupations. So this has been done by a few other researchers. So what they do is that they have sort of very detailed information on what people do. So people who are engaged in the different occupations, what exactly is it that they're doing, and what sort of tools, what sort of equipments, what sort of technology they use. And typically, I think this is sort of very closely related to the usage of computers. Okay, so people who tend to use a lot of computers for their work, they are more likely to be able to work from home. People whose job does not involve the use of computers, they would find it much more difficult to work from home. So that's kind of the basic idea. But then these guys, they sort of go out and measure these things in a lot of detail, and we basically take the numbers from them. But of course, you have to do it. So this is the way you sort of do the ability to work from home.
sir,
Yes.
one more question. Arindam Das, who says, I think mobile networks are becoming a big barrier to working from home. Although the current situation is new to us, and I think over time we will overcome this adversity. What do you think?
Yeah, well, I mean, so I guess there are two parts to your question. One is that mobile barriers are kind of a problem, or mobile network is kind of a problem, and then when is do I think that we'll overcome this? So first, yes, I agree. I mean, this is something we are facing. I face all the time. So we are, I think in a lot of places we have moved to online teaching. So at IIM Bangalore, we are doing the same thing. We've already started teaching, and we're doing everything like meetings and teaching. So everything is happening online. And yeah, I mean, we face this issue all the time. I mean, I see, I taught this morning, and then some students suddenly sort of got locked out or whatever, because his connection dropped. So this is an issue. But yeah, I think going forward, I mean, I'm pretty sure this is, now that, this mobile or whatever, internet is going to play such an important component in our lives. I think there's going to be a lot of investment to try to improve the quality of these. Now, having said that, I should also mention, because this is something, I think a lot of people have been discussing about. Another way in which inequality is shaping up in India is actually through these mobile or because of these mobile networks. So mobile connection or internet connection or internet connectivity is not the same for everyone. And again, if you sort of try to look at kind of data and see that there will be some sort of a strong correlation between the quality of connectivity and, let's say, your income and your skills. Okay, so people who are highly skilled, they have higher income, they can afford very high quality mobile or whatever, they can afford to spend a lot on mobile connectivity. People who are low skilled, you go to rural areas and it's like, the connectivity is very poor. So again, so this, the fact that mobile connectivity is not the same across for everyone, this is another source of inequality. So, and that is something that is being felt a lot in education. So students, we have students at IIM Bangalore, we have students who live in big cities, and we have students who live in small towns. We have some students who live in villages, and their ability to sort of connect, to sort of log in to our classes and listen to lectures is not the same. And so that, I think, is not the problem. But that sort of also says that we need to do a lot more. We need to, the government really needs to work, and the private players need to work to improve the quality of mobile networks.
There are one more question.
Yeah.
From Ritika Ghosh and Pujya Ghoshal, both are similar in nature. So I may say that what may be the government policies? The question is, what may be the government policies that could lessen the growing inequality in India due to COVID crisis?
So this is something I I think I sort of spoke very brief. I sort of just mentioned very briefly in the last slide. So it has to be government transfer because look, the thing is, the kind of work that a lot of these low-skilled workers are doing, the kind of work that they engage in, you cannot come up with a technology that will allow them to work from home. That is not an option. As a person who drives a cab, that person cannot stay at home. That person has to go out, right? So if you want that person not to go out and expose themselves to risk, and of course, also the fact that even when you go out these days, for someone like a cab driver, no one is getting on the cab. So even if you go out, like who's going to get on your cab? So the only thing, the only solution here is transfer from the government in large scale. So in the paper, we we looked at these different, these lockdown scenarios that I kind of talked about, and then of course the inequality. In different scenarios, you get different kind of different inequality numbers. But again, we sort of did a very sort of rough calculation, and the number that we got is, if the government wants to prevent this inequality from going up, income inequality from going up, it needs to spend somewhere between 0.2% to 0.5% of GDP. So that would be, I don't know, maybe something like 30,000-40,000 crores, some numbers sort of along those lines. But yeah, there's really no other way, because you cannot come up with any technology that will solve this problem. It has to be monetary transfers.
More question is there from P. Radhakrishnan.
All right.
Sir, will you please explain the economic impact on India, which needs to assess consequent to shape of the shock and its structural negation of its nature and extent of the disease burden, and how it is possible to recreate India without FE from the refugees at large weakened India.
Sorry, how can we? So I didn't understand the very last part.
How is it possible to recreate India without FE? I hope it is further effect or something like that. FE from the privacies at large. Privacies of privacies.
Oh, okay. Well,
Once more I repeat. Sir, will you please explain the economic impact on India, which needs to be assessed consequent to shape of the shock and its structural vigor of its nature and extent of the disease burden.
Okay, so I think it's sort of very. I think it's sort of
very long question.
Yeah, very broad. No, it's also kind of a very sort of broad question, and I think there are. So I think there are the few things that we have learned from this. I think there are a few lessons to learn from this, and I think if we acknowledge, if we acknowledge these, we realize that there's certain drawback, there's certain structural problems in the economy, and if we acknowledge these, then maybe we can do a better job of fixing, maybe trying to fix some of these, and hope that if something like this happens in the future, then then we are in a better position. So I think one of the things that we have, the two things, one is healthcare. Right? Our healthcare system is terrible. I think it's something we always knew, but I think the COVID-19 has sort of brought it out very, very clearly. The public healthcare system is is really, I mean, there's really a lot that needs to be done. Maybe some states do better than others, but still, I mean, there's much more. I mean, much more investment that is required. So in terms of healthcare expenditure as a share of GDP, India has has one of the lowest figures among sort of the major economies. So that is something we need to work on, and the other thing is, we don't have a social safety net. Again, this is not something that it's not something that that's unique to India. I mean, developing countries typically don't have social safety nets. I mean, because we typically, it is very expensive for us to provide, sort of these. But so what I mean by social safety nets is that if you go to the developed countries, if you go to countries in Western Europe, countries in North America, they have something called unemployment insurance. So what is unemployment insurance? So basically, when you are earning, when you have an income, you basically every month, along with your income tax, you pay a certain amount to the government, which is like an insurance. So this is insurance that you're paying in the event that you get unemployed. Okay, so just like any insurance, so the idea about insurance is that the basic idea is that every month I'm going to pay some sort of premium. So I have a health insurance, every month I pay a premium, so that when I actually get very sick, then I get a lot of money from the insurance company to help me out, okay? Unemployment insurance, the idea is the same. So every month when I have a job and I'm actually earning, I pay a small premium to the government. And this is to the government, okay? Not to some company. I pay it to the government. And when I lose my job, the government actually pays me. Okay, so if I'm unemployed for a few months, the government, during that time, the government will pay me a salary, will give me an income. Okay, so a lot of these the countries that do this, they're typically called like welfare states. They do a lot of other things. So healthcare is typically sort of very cheap, or many of these countries it's free. But there's also unemployment insurance. India, we don't have that. In India, you're unemployed, it's like fend for yourself. The government will not do anything for you. Okay, and in a situation like this, in pandemic, so when you think about the developed countries, and every country has been affected, but in a lot of developed countries, the situation is not as bad as here because they have unemployment insurance. So at least for the first few months, when a lot of workers lost their jobs, the government sort of took care of them. Here, we don't have that. I mean, here, a low-skilled person or any person loses their jobs, they have to fall back on the savings or the family members. And for poor people, I mean, they have no savings. I mean, most of them are probably indebted. Okay, so these are things. These are sort of major drawbacks that maybe we don't usually talk about, and no one really worries about these things. But I think the pandemic sort of has brought these things to the forefront, and maybe going forward, these are things that we need to work on. So maybe some sort of unemployment insurance scheme for workers, and definitely trying to invest more on our healthcare system to sort of raise the capacity as well as the quality of our healthcare system.
One more question is there.
Yes.
And this is the final question.
Okay.
Question from Shantanu Ghosh, head of the department,
Okay.
College, head of the department of economics.
All right.
He asks, developed countries with better technology can offer greater scope of work from home or from remote locations. Will it then rise global inequality across nations?
That's actually a very good point. It should, right? I mean, if you think about it, so now if you just don't look at, let's say, high-skilled workers in India versus high-skilled, low-skilled workers in India. Now, if you compare workers in India versus workers in, let's say, US or Canada or United Kingdom, if you look at this entire population of workers, yeah. And I think there's been some, I mean, although we have not looked at kind of poverty per se, but there are some studies that seem to suggest that global poverty is going to go up tremendously. So, and it's very unfortunate because in these last couple of decades, like in this century, between 2000 and 2020, I think the world had made tremendous progress in terms of reducing absolute poverty. So a lot of people have been sort of brought out of poverty, like abject poverty. And this pandemic, I think, is going to turn the clock back, and a lot of people will sort of slide back into poverty. And so if you look at if we look at the entire world population in that respect, I think it's going to increase. It should. I mean, it has to increase inequality at the global level. So that is, I mean, I did not think about it, but I think that's that's kind of like spot on. I think that's a very good point. Thank you.
Thank you, Dr. Rajgupta,
Thank you.
for your nice presentation,
Thank you.
and I hope I will give vote of thanks now. So
But before
we have-
that, I think on behalf of the department and college, I must express our gratitude and immense thanks to Dr. Dalguto for a brilliant presentation, a presentation which is full of theoretical issues. And I think those who are interested in rigorous theoretical work on COVID-19 and economic crisis, for them it has given a lot of windows. So yes, it is still at the nascent stage, as you have said, but I hope we can do a lot of work on this field, and we are really grateful that even after a 2.5 hour marathon session with your IIM students, you have spared so much time for us. Thank you. And we look forward to your future participation again. We will bother you again.
No problem. No.
Thank you. Now, Barinba will wrap up.
Okay, we have already come to the back end of the webinar session. So, for the vote of thanks, I may thank all the participants and all the members of the webinar committee for their wonderful job. And we have been successfully organized our one-day national webinar on the topic, the COVID-19 economic crisis, by the Department of Economics in collaboration with IQAC, Maulana Azad College. For this, first of all, I thank our principal of Maulana Azad College, Dr. Subhasis Datta, for his enthusiasm and encouragement to organize such a webinar. I express my gratitude to both of our speakers, Professor Abhijit Sarkar and Dr. Kunal Dasgupta, for their excellent presentation. We are grateful to them because they have joined our webinar as resource persons, and I hope we shall get them in our college physically present after this pandemic situation will be over. And I welcome both. I thank our IQAC coordinator, Professor Sumit Dasgupta, for his continuous support to make this webinar success. I also thank our head of the department, Shantanu Ghosh, for his continuous involvement to make this webinar a success. I also thank all the members of the webinar organizing committee, especially to Samudra Prasad Boni, Abhishek Ghosh, Subhajit Samanto, and all the computer personnel, those who are involved, because without their effort, we could not have organized such type of webinar. I thank all the delegates who are present in this webinar, all the scholars, students, and all the participants. I must thank Bipasha Roy for her marvelous anchoring. I thank you everybody once again. Thank you all. Over to Shantanu.
So, thank you all again. I think it is lunchtime. We should not detain people long. So, only thing is that in this virtual seminar, we cannot provide lunch. Had it been in the college, but hopefully in near future we would have physical seminars again. So till then, have a nice time, and thank you, Dr. Kunal Dasgupta, again. And we hope to be in touch. And I think some participants will now chase you.
One more announcement is here. The feedback link will be sent to all the participants in their email. So you check your email and fill up the feedback form. Thank you.
Thank you. So I think we should stop here and quit. Yes. Dr.
Okay.
Kunal Dasgupta,
Yes.
please break for lunch.
Okay. All right.
Okay, thank you. I will not detain you.
Okay. Thank
It
you.
has been a marathon session today for you since 10. Okay,
Okay. Thank you. Okay.
thank you. And thank you all the delegates. Okay. বারিনবাবু, প্রিন্সিপাল স্যার আছেন তো?
হ্যাঁ,
আচ্ছা, প্রিন্সিপাল,
আছেন, বলুন।
হ্যাঁ, আমাদের কলেজের থেকে কারোর কিছু আর মানে কিছু ডিসকাশন আছে? ফিডব্যাক লিঙ্ক সমুদ্র উইল সেন্ড।
লিঙ্ক পাঠিয়ে দেয়।
হ্যাঁ, so should we log off now?
Yes, we have. We can log.
Abhishek is there?
Yes, sir, you can log off. We will wait till the last participants leave.
Okay. So I am also then logging off. I am here. So let us wait for the participants to.
Yes.
Uh,
I think we should
wait.
do that.
Okay. I am